I'd like to call this meeting of the St. Andrews Task Force to order. I'd like to announce that the reason I'm banging that gavel right now is Chuck is not feeling well. He called me, left me a message, and he assured me if he gets any worse, he will be going to St. Andrews. I've since found out that Valerie is also not well, so it's just us up here tonight. So with that, we are going to go right into reports. Bruce McDonald, would you highlight us on where you are?
Okay, that was fast.
That's what I try to do.
I'm chairing or being the point person for what has been called the Community Hospital Working Group. And before I start on sort of a couple of updates as to where we are, I just want to remind people, both here and in the audience, that the community hospital idea, I put it forward because I thought that it was a nice differentiation between the behind-the-doors process that went on with the St. Andrews closure of the ER process that we saw, and the openness that will come with a community-based method of governance. I think we've talked enough about that, so I won't go into a lot of detail, but I want to say that even though I think that's a really interesting option going forward into the future, to have a community-based governance form, which means that your board of directors is elected by the town meetings in each of the different towns that are members of a special district. They are responsible to the public, the meetings are open, their bylaws are open, everything about it is open. That's only one method, though, of going forward. So I don't want us to get married to the idea that the alternative to what's happening is a community-based, or rather a community special hospital district. There are other ways of governing, including continuing with a private board. If we could convince the existing board that we have a better plan, then so be it, and we could go forward with that board. Or some other alternatives may be out there. So even though we call ourselves the Community Hospital Board, I want you to know that the method of governance is not so much the issue as the fact that we want to continue with a healthcare operation here in the Boothbay region that is much more robust than what Lincoln County Healthcare is planning, which is the shutdown of the ER, the existence of some services which many of us believe will wither away as the urgent care facility is probably underused, and eventually we see, I think, that the entire operation may come to an end under that scenario. So we're looking at a more robust way of doing this, governed in some way, possibly by a community hospital or some other way. We have been meeting. Yesterday we had an update, a good update by Peggy Pinkham about what the meaning of a critical access hospital is. It will be aired on Channel 7. So we think that critical access designation for this, whatever we have going forward, is going to be an important thing. We don't want to lose it. There are financial benefits and other kinds of benefits in the way the institution will operate that come with the community, critical access rather, hospital designation that we don't want to lose. The problem is that we have been handed a situation in which we are going to lose it at midnight on March 31st or March 30th, whatever the last day of March is. Coming up the 1st, I'm not exactly sure how that divestiture will take place, but we will lose our critical access designation when we lose the hospital, the emergency room in the hospital, the designation as a hospital. So we have very tight timelines to do something, and we are going forward with. So we want to keep that critical access hospital designation, and Peggy's explanation of what some of the aspects of that will be really useful for you to see on Channel 7 and perhaps in the Register. and we'll put more documents up on the Google Groups document site to talk about what a critical access hospital is. Our group has formed a kind of what we're calling a focus group, which is going to focus entirely upon creating the new plan. We are talking with some consultants. We are looking to create a plan. And by the way, we have some volunteer members from our greater community who have an amazing set of experiences and skills that can help us. I'm just the front person here. I don't know these issues. We have people in our group who know these issues inside and out. And some of them want to be known and some don't. So you don't press me too hard on who they are. But trust me, we've got some great people who want to see this institution continue. And we're going to be working with them. I think that given the timeline that we have, our drop dead date for having something that is full, and understand that we're compressing probably what ordinarily should be years of planning into months of planning because of the timeline we have. We're going to try to have something ready for prime time by January 1st, by the end of December of this year. But in the meantime, we are going to try to stage out some ideas, some outlines, some based upon a look at what are the real healthcare needs of this community, of our communities all taken together. We're looking at something called population-based healthcare planning, which really looks at the entire life cycle, if you will, of healthcare for individuals and for communities, and could take in things like substance abuse issues among younger people, all the way through to end-of-life care for people who are at the end of life. So it's a big task. Data does exist. We have people working with us who know what that data is, know how to get it and how to use it. One of the astonishing figures that I heard in our little discussion was that in our peninsula here, our healthcare spend in our communities, I don't know if it includes Damariscotta or not, but Edgecombe on down is something like $40 million a year that we spend in healthcare. I mean, if you take 6,700 and divide it by some number, if people spend $5,000 or $6,000 a year on healthcare, you get to see an enormous number, which means A, that our healthcare needs are large, but also that an institution that wants to address those healthcare needs really in a robust, comprehensive way, like this population-based kind of look that we are talking about, that people are spending money on, they're spending healthcare dollars. Why couldn't they spend it here? Why couldn't they spend it on an institution that exists here to serve the needs of the people who are here? So those are the things that we're looking at. It's premature to say what that plan will look like. It's also, I have to say honestly that we still do not know how we're going to fund what we need to fund. Some of these things can cost a lot of money. It isn't nickels and dimes, we need dollars and dollars. But again, we won't be able to go a full-blown thing. I mean, for example, we might want to survey our community, but we heard yesterday that from Andrew Twaddle, who's done this kind of work in the academic world, that it could cost us $150,000 just to survey, to do a comprehensive survey. On the other hand, even having said that, we also know that databases do exist. The Navigant report that came from Lincoln County Health, or was given to Lincoln County Healthcare, has some data that we think is useful. The Y has data about our demographics. Our consultants have some data about demographics or other sources of data that are reliable, so that we, in this first blush, we're probably not going to be able to do our own survey, but there is data out there that we believe we can base a credible, strong plan for what a healthcare institution based here and serving the people here would look like. So we're going ahead with that kind of work. It's happening as we speak. We have a little wiggle room on when we have to start spending some money on it, but we're going to need some help to fund a plan, the kind of plan that I'm talking about that would come forward to. And then what are we going to do with that plan? We believe, perhaps naively, that we can present it back to the board of St. Andrews, acting as the board of St. Andrews, to show them what could be possible and what, in fact, will be based on data from our population, what ought to be done. And if we can get a hearing with them on that, then that will all be to the good. And if we got a positive result, perhaps we can see some change that would come about from it. So those are the things we're working on. We're working on carrying on. We are going to need, and I don't know how the funding and the fundraising goes, but we're working on the planning part of it, but we need some help on the fundraising department from all of us and from the community. With that, I'll stop and see if there are any questions.
Anybody have questions for Bruce? Thank you very much.
What I would just urge you is to, even though things are not public yet, and I would urge you not to lose faith. Okay?
Amen.
It isn't just having faith, blind faith. It's that we have some good people working on a problem that looks like we can put something together that would be really a strong and credible argument for continuing on here. But so I've heard some people say it's a done deal. You can't do anything about this. You guys are tilting against windmills. I do not believe that. I believe we have an opportunity to describe something new and different and exciting, which one of our people even said could be a model for not only the state but even the nation for rural health care. So we're going to stay at it.
Bravely forward.
And we hope that you will too.
Thank you, Bruce. Appreciate that very much. And I would reiterate what he said, that I had somebody earlier saying, they were concerned about the numbers of people here, and I assured her that she should be encouraged by the amount of people that are here. I go to a lot of meetings, and believe me, this is wonderful to look out here and see these shining faces that are concerned. Do not give up hope. Do not give up faith. There's a long way to go in this battle. Moving on to data analysis report.
Mr. Twaddle has kind of turned into the point man on data analysis, so we added him to the agenda.
It's a short-term thing, because I'm only here till November, so somebody else is going to need to do something with this. We're putting together a folder as the other task forces are doing. And I want to just give you a rundown of what's in it and some other things that we're pursuing. We have in here the questions that have been posed to the data committee. We have tax returns from St. Andrews from 2007 to 2008. We've got summaries of the assets and liabilities of St. Andrews from 2004 to 2011. We have questions about the Navigant report that I generated from my reading of it. And those questions have been passed on to Stacy, who's agreed to provide us some response to it. Maybe tonight, maybe not. We'll see. And I also should note that let me just do it in order. There's papers on a paper on the trends that underlie the St. Andrews crisis. There's the Maine Health Strategic Plan is in here. There's an analysis of the ER visits by acuity level in 2011 by Dr. Judy Stone. based on Sue Mello's articles. And just personally, I'm just awfully impressed with Sue's reporting on this.
Amen.
She's been great. New York Times and the Los Angeles Times both have articles on problems with Navigant Consulting. And they're probably worth taking a look at. Now they're in here. There's a paper here on increasing access to health care. There's the main corporate structure, the main health corporate structure diagram is in here, so you can see how that's organized. There is a paper in here from the Canadian Emergency Department Triage and Acuity Scale implementation, which seems to be the scale that is used in the Navigant report. There's data from the Maine Hospital Association, which is a FAT report here that covers, it must be 80 pages, and it covers just about everything about St. Andrews that you want to know about, in terms of its utilization, financing, expenditures, things for the years 2011 and 2012. And then there's the Booth Bay Register articles that include data on the hospital are in here. As I say, we've put out an inquiry to Stacy to get some response on the Navigant report. I have sent prepared emails to Catherine McGuire at the Muskie Center in Portland, who seems to be the data point person for that organization now, and to Garrett Martin at the Center for Economic Policy Analysis, because they are also do analysis of health data for the state. Unfortunately, my computer decided it doesn't want to send email this afternoon, so I'm waiting to see if I can get that resolved sometime tonight. So that's where we are, and just wanted to get you up to date so you know what's in here.
Thank you very much. Any questions regarding that? And Stacy, did you have any updates for him that you wanted to share?
No, not at this time.
Okay.
Sorry, we're not ready.
I don't know if anybody understands how grueling some of that work that Mr. Twaddle and everybody that's helped him has done. That is absolutely, that's probably the most amazing part of any of the research that we've done, is to comb through page by page all the information there and try to find out what is worth an extra look and what is not. It's just a lot of work, and my hat's off to Mr. Twaddle.
Amen.
Thank you.
Thank you so much. Very good. Moving on to the volunteer coordinator and the press release.
Today you should have received this weekly update. If you did not, I have extra copies. Thank you, Ken. Again, we still we're looking for more volunteers. We're looking for leadership and fundraising. I'm sorry that Valerie is not here tonight. Who's reporting on her grand success tonight? Is that you, Jim?
We'll get to it.
Financial, yes.
Yeah, we'll get to that.
We've kind of added some new features to the weekly update. It's only in its second week, and we're already adding features. At the end, the very last thing on the newsletter, you will always see the new questions and what's happened to them. As the questions have started to come in, we have to put up stuff on every wall, and so those are the original questions and where they have been channeled. Now we have just taken the questions and putting them in the books where they should be addressed, and if there are questions there, those work groups are being notified that there are new questions. Then the request from volunteers in the community, we have office hours 2 to 4. Last week, the task force approved the Channel 7 tapes as the minutes of these meetings, but we have had a request for actual minutes. And instead of doing that, we are going to log the tapes like they do in broadcast. And Pam Reed started that this week.
Boring.
Not that you're
Nothing
bored.
personal.
And all that means is that on the tape, there's a time code, and we put the time code and then who is speaking. So that, maybe just a sentence about what they spoke about. I think most of us know when somebody stands up, what they're speaking about. Then if you want to come in and see what was said about the Booth Bay Region ambulance service on a particular tape, we can take you right to that moment on the DVD, you don't have to spin through it. We have all kinds of things. The volunteer needs are on that list. I won't read them to you. I know you can read. We will be putting together a calendar of events because there are lots of people who want to be involved with things that are happening in the community. And we need to find people to man tables, to be smart. Even tonight, we're talking about doing something with the early bird sale. What that is, well, we need a calendar so we can get organized and everybody knows that it's there and somebody can say what's happening and who's in charge. And then the last new thing on our newsletter this week is what's requested specifically from the task force, and I no sooner put this out this morning than I had responses from Stuart on what he was going to do. So hooray for our task force, you're doing great work too, we appreciate it. But if you have any questions, I've still got the sign-up sheet. If you want to volunteer, you don't have to sign up for a work group. But as Andrew told you what was in his book, we try to make sure we have hard copies of everything that people are discussing so you can look at them, and also in here the links to, if there is a link to where you can find that. Any work group leader can come in and do a table of contents for their book, and that would be great so that anybody who wants to pick up a book can see what's in that book. Other than that, thank you all for doing a great job, and I'm excited about the financial news.
Thank you very much, Peggy. Appreciate it very much. Any questions for Peggy before we move on?
Can I just add something?
Absolutely, jump right up there.
I will. Okay, I made a list of what I think are the associations in Boothbay, Harbor, Southport. I didn't know, are there any in Edgecombe besides Quarry Farm associations?
Oh, yeah.
I'll have to get them from
Okay.
somebody then. And I'd like to be able to find out names and addresses that go with them. Jim said his assessor will give me all the addresses for Boothbay that they send tax bills to, because we'd like to ask Bay, plead for some money to help. Whether we get it or not, you don't know. Huh?
I'll send you all that for Edgecombe.
Oh, great, I'll give you my email.
Okay.
Okay, thank you. If anybody wants to look at this, if they want to add anything to it, it's sitting right up here.
Excellent. Any other questions?
I just want to say,
Yep,
Peggy, I'll say it publicly, I think this is great stuff that you're doing here.
outstanding.
It really helps to have it, everything.
Thank you for saying yes.
Yeah? Helen?
Yes, Sunday, Ruth Farron is doing some things out in front of Hanford on the corner. And we were up a little too far this time, but we're going to be on the corner. And where she has a difficult time communicating, I was her sort of mouthpiece, okay? And I ran into some very nice people. There was a couple from Vermont, an older couple, very, very nice people. And they wished us well and hoped that we could go on and get what we would want here. And then I met a lady from the AG's office who gave a donation also. And I believe, where is he? There's another gentleman here that he was there also helping out. And we could use a few more people.
Now, what time and where again, so people know this?
12 o'clock on
I'm
Sundays.
sorry, wait,
when
nice and loud for the camera.
Oh, I'm sorry. 12 o'clock on Sundays, from 12 to 1, is just an hour. And we had signs, like Toot if you want to save St. Andrews, or they had other signs, and this was all due to, some of the signs were made up by, by Freddie Luke. And because she now is supposed to be leaving, so we have, Ruth has all the signs in her vehicle. So if anybody would like to join us, that would be great. And I also see some other members of the seniors, if I remember. And Debbie Mullen, I saw her name on there, and I'm one of the seniors too. And he's from anywhere from 50 on up, I believe. And she asked me something about setting up a table or something at Senior Appreciation Day. So, and I see that her name is on there, so she's made contact. So that is something that
Helen,
we may be doing.
do
Yes.
you remember how much you raised last Sunday? with your
I believe
demonstration?
with everybody and with my donation that, I mean, not mine, but this lady's donation, in that hour, it was a little over 100 or 100, just in that
Outstanding.
1 hour.
Thank you.
So, you know, it was a beautiful day. People went by and people came, you know, and they stopped to talk and check out some information. So we gave them what information we knew and everything, but it was a very responsive attitude they had.
Thank you very much. Anything else?
I'd just like to report that there are a couple of people stopped, amazingly, saying, what, they're closing St. Andrews? These are people that live here, that don't read the paper, that don't, et cetera. So the message conveyance that is implied by these people with the signs out in front of Hannaford's is not to be underestimated.
Amen.
And also, there's a banner that is supposed to get put up over Route 27, which...
As far as I know, that's still coming. Yeah.
Well, the banner was in evidence the other day. I'm not sure what happened.
Where'd it go?
There's a new sign right out here on the ambulance property.
Right.
Tuesday. Pat Farron set up, was it this morning or yesterday morning? They're all blending together now. So the gateway into the Boothbay Harbor area. So.
And that's a thank you to Clive, I'm sorry, to Pat Farron and Sons, and the picture was sent to the newspaper of the installation, so watch
Excellent.
for it.
Great.
Very good. Bruce, you had something to add?
Yeah, just on the volunteer issue, do we have somebody who is, Peggy's doing a great job with everything she's doing. One step beyond that might be somebody who's looking to engage Portland Press Herald, you know, the large newspapers in the state, even New England papers, even beyond that, because this is kind of one of those David and Goliath stories. As we move forward, I think we want to build momentum for the point of view that we have that small rural hospitals don't necessarily have to die.
Right, but they're important.
And is there somebody, I think Peggy's tapped out, a lot of us are tapped out on different things. I wonder if we have any access to somebody who can take the PR thing to another level. It's just something I'm raising.
I know somebody who's working behind the scenes that doesn't want to be named that is moving forward on those things.
Excellent.
And that's all I can tell you. But,
Okay.
so the short answer is, I think, yes.
And that's one of those avenues where probably somebody that understands PR and then a good writer can team up together. Because those are things that we can submit articles to. So if there's somebody that's paying attention that's a good writer that hasn't participated, I know everybody has participated some way. But if you're waiting to find your niche, that might be it too.
Absolutely. Okay, let's move on to the Boothbay Urgent Ambulance Service Work Group.
We didn't really tell Scott he was going to be on the spot again, but I wanted to see if there was anything new.
Not a lot publicly that is tangible, but privately, we've been meeting with a lot of groups in the community, kind of discussing with them what the implications are for the transition to transport to a different hospital, and kind of using this as an opportunity to re-engage with the community and to let them have a voice in what they want their ambulance service to look like and what sort of needs that we're going to have, and to strike that balance of what is affordable for the community and what we can provide and what the expectations are for everybody. So we've met with a couple different groups. We've had some private citizens stop by the station in the last couple of weeks and use that as an opportunity to just kind of start to do the open dialogue that we're hoping for to take the next step for us. We're also recalculating some of the capital improvement budgets this week. I'm also hoping to have some written responses to the questions that are behind me so that everyone can read them and share them and have a chance to further discuss them and come up with anything else that they want. So that's what we've been working on the last week or so.
We didn't expect all the questions that came up to Scott last meeting to be as good as they were. And then all I heard over the last week was how I learned a lot from Scott on Channel 7 about questions that pertain to the ambulance service. So we may not have those questions tonight, but one of the things that we are trying to work on is how do we get those questions to the ambulance service And then with Channel 7, how do we deliver those to the people? So if you have questions about the ambulance service, worst case, best case scenario, whatever questions are available, try to get those to Peggy, the Google groups, myself, any of the task force members. We all know how to get it funneled right back to the same spot. And we'll continue to try to get a method of delivering the answers back to the people.
We did develop, prior to this, we were working on a website. So we have that, the initial draft of that done, and hopefully by this time next week, there'll be a better vehicle for people to make some sort of email contact. So it would be another way if they'd like to reach us, and that should be ready for next week.
Thank you very much, Scott. We appreciate it, as always.
Thank you.
The next issue is the economic impact study. Got anything at all?
Well, yeah, there's Barry Allen. I said, we've
Oh, she
been
here?
working on it, and she's
Yeah.
right back here, so I'll let her elaborate.
We've got some, we're collecting some data, and some of your subcommittee. We've asked Lincoln County Healthcare for some information about what they project to be the changes in employment, and so we received that at the end of last week, and I met today with Cindy to review that. So there's a little bit more data that I want to ask her for. So that's kind of important because we're talking about employment loss, though that's one aspect of the economic impact. So what we're also trying to do is finish up collecting the information that we have pretty handy. And we're also trying to identify not only work that we can do in-house, but also professional economists that can just run the numbers through a model. When you're talking about economic impact, basically there's a lot of, what you do is you compare what's happening in your region with what can happen across the country. So they put Lincoln County and Booth Bay Harbor into a model to generate additional impacts that we can't possibly do based on the small numbers that we have here. So we're trying to line up some resources for that, both financial and staff. And I haven't called a meeting of the work group. I think there's a few people who would like to help out, but I don't want to jump on that prematurely and waste their time. So I'm hoping that in the next 2 to 4 weeks we can meet. One of the thoughts that people have is what's the value of an economic impact study? And many people don't like to study the negatives. We don't like to study the loss of things, and so it's why it's a bit of a challenge. But it can also be leveraged towards getting foundation grants to allow communities to do something that's innovative. So even though it's a look at the negative, which is the loss of income or the loss of jobs, basically the point of this is to turn it around and to attract resources that you need to move forward. So the other question that I'm trying to frame in terms of detail is what's the relative impact of what's happening now in the next year or two, and what's going to happen in 5 years? And can we nail that down with enough numbers that it can run through somebody's model? So that's a little less firm, if you will. But I don't think the impact is just what's going to happen next April. It's going to be, we're going through a lot of changes in healthcare. So how many scenarios can we run? But I am concerned too about the long-term sustainability of what remains at St. Andrews or what evolves at St. Andrews and also at Miles. So there's the longer-term view that we want to take as well.
Amen.
So I'm just trying to pull together resources and data, and possibly definitely within the next month, we'll pull a few people who we volunteered to. And I owe Mr. Twaddle some data, so.
And we're also I'm talking to MDOT about certain road upgrades and things of that sort, and the cost of that.
Excellent.
Now, we'd like to just add, our Regional Planning Commission covers all of Lincoln County, and we handle a lot of different issues, and our every other month regular full board meeting is in about a month. And we're going to hold it down here. I'm just trying to come up with the right kind of meeting space. That would be an opportunity for our board to do a lot of our own business, but also to maybe set aside an hour or so to talk about St. Andrews and the implications in the community. So I'll be working with Jim to finalize a location, but we can get the word out. Again, the hospital and the healthcare will be an important part of the whole agenda, but not the full meeting. But we look forward to meeting because we have active members in Booth Bay Harbor, Edgecombe, and the entire county. So we'll be coming down this way in about a month.
Thank you so much. Financial fundraising.
Put the financial and the fundraising together because they just go hand in hand since all of our finances have been through fundraising. Until today, where the town of Edgecombe did donate $500 to the St. Andrews Task Force, the first municipality that has donated straight to the task force. Also, a press release went out recently in which the McAvoy Foundation has upped the ante on what they originally were going to give to the task force, and they've decided to give a $5,000 matching grant. So for every dollar we raise, they'll match $1 in $1,000 increments up to $5,000. Now, just to show you how much of a leadership position that can have in fundraising, when we got the announcement of that fundraiser, that matching grant from the McAvoy Foundation, we had $6,980 in the fund. You can see the scratchings on my paper because we're still receiving donations. Right now, $12,909.35, an increase of $5,929. $1,000 of that is the McAvoy Foundation, and as soon as we let them know how much we've raised, they'll match that extra $3,000. So that's $16,000 right there. Very impressive.
I want to thank all you people. Thank you. Don't quit now.
We wish there could be more, Jim, but we don't have a contingency fund like other towns, so.
And I'll admit right up front that I forgot to ask my other board members completely, so I throw myself in the mercy of the bullet. Don't worry, we'll get to him.
Because Chuck is sick, we had a small amount of selectmen at our last meeting. They didn't actually entertain the question. They'll entertain it at their next meeting. But I'd still tell you, if you think that tax dollars are something that the Board of Selectmen should put into this fund, you need to let them know, because they're tentative about doing that, because we raise these dollars for some very good public purposes. Sometimes there are extra dollars for economic development. Sometimes there are extra dollars available for good causes like Channel 7. There are contingency funds too, and those can be used at the discretion of the board. They need to know that the people support whatever they do with those dollars. So if you support it, you need to let them know.
Thank you very much. Okay, moving on. Do we have any old business that we need to address?
We don't have any old business.
You have anything, my brother? No. Excellent. We will move on. New business, which moves on to a recap of the next meeting. I think before we do that, I'd like to go and get some public comment, if you don't mind. So, we're going to throw this open to public comment. Any questions, concerns, queries? Yes, please. Please rise and identify yourself.
Yes, my name is Tam Back, and what I have a question about is I'm a person with mental health issues, and I use St. Andrews mainly for my mental health issues, to go there and be seen by other mental health counselors to be transferred to other places. And I was wondering if there's anybody looking into the fact, is that going to still be available? Is it going to shut down at midnight when they're, once the critical care unit shut down? Because there's a lot of issues with somebody being placed there and then transferred at midnight, and then transferred again and transferred again, because you're just going through so much stress at the time, and the more transfers you have to go through, the more stress. So I didn't know if that had been...
Gage, you got any answer to that?
Well, Stacy Miller, Vice President of Physician Services for Lincoln County Healthcare. What I would tell you is the mental health services that we currently have at St. Andrews will continue and hopefully grow. As far as use, I think what you're talking about is use of the emergency department. So it'll be an urgent care center. So if you walk in to the urgent care center, you will be taken care of, however clinically appropriate that happens to be. There will not be the option of staying there or taking a bed. Not that that's an option today. It's not an option for you to be admitted to St. Andrews today.
Correct, but what I'm thinking of is when you're there, you see a mental health worker who comes from suites usually.
Right.
And
Crisis.
the suites of crisis could be at any time.
Right.
So it could be after midnight. So are you going to be then transferring people from St. Andrews to
Yes.
another hospital?
Yes.
So that's what's going to be happening.
Yes.
It's going to be a lot of transfers
So,
happening.
should you walk into the urgent care center and need mental health services, they determine it's crisis. My understanding, I'm not a physician, we'd have to ask, but you would then be transferred to the appropriate facilities. They would probably call the ambulance service, transfer you to the next appropriate facility, and then go from there. But we can ask.
Unless it was after 8 o'clock at night.
Right.
Yeah.
Right,
In which case,
right.
you're toast.
No.
Right, I mean, because I've just used
You
it
would-
as well, where my
so
therapist
what-
that works over at the family care center and also my doctor, and they both walked me over to the emergency room to receive care, and I'm just wanting to make sure that that care is still there for somebody that needs that care.
Right, and then I would say from a crisis situation, community members will need to call 911, and they will be taken to the most appropriate facility.
Thank you.
Thank you for bringing up that very important issue. We appreciate it very much. Any other? Yes, Brian?
My name is Brian Blethyn. I'm a resident of the town of Booth Bay. So I would just follow that up. I was just curious, do the ambulance, do they answer mental health calls?
Yes, we do.
Okay.
We also do the transfers. Most of the mental health transfers happen after hours because the receiving hospitals, their intake process occurs usually after 10 p.m. So I'm not sure what would happen if the urgent care center shuts down at 8 o'clock, because a lot of times the facilities don't take a patient until 11 o'clock.
Sounds like an extra long ride.
It's just their admissions process. There's a special process they have to go through with their mental health workers, and the nurses that are on staff have to evaluate and to make sure there's appropriate bed space and make sure the staff is appropriate to handle their patient population at the time. So most admissions to those facilities happen later on in the evening.
Thank you. Other questions? Yes, please.
Hi, I'm Patty Siebold. I'm a resident of Booth Bay, and I'm on the working group for the community hospital. And in addition to the survey that Bruce mentioned for the population-based planning, we also want to do a qualitative set of interviews. And I have volunteered my services to interview about 50 people in the four communities across age groups and demographics. And what I'd like are volunteers. So I'm going to start by passing around a little sign-up sheet to be interviewed, not to interview. It will be either a face-to-face or a telephone interview, about 30 minutes. And I am working on the interview guide. I'll be circulating it within my working group, and it will be posted in Google Groups. So if you have some other ideas about questions that don't really belong on the statistical survey, but really are more kind of what do you want for your healthcare facility, both in terms of the hospital, but also wellness and general health. So I think we're all kind of heading in the same direction to try to get a pulse of what we need. So I'm just going to pass this around, and anybody who would be willing to be interviewed or has some ideas about people I should interview, I will be talking to the employers and to trying to approach the schools as well to talk to some of the students.
Outstanding. Thank you very much. That's wonderful. Other questions, concerns, comments? Yeah, jump right up there.
Go ahead, Bruce.
I just was wondering if the task force will, what I'm thinking is that we need another, at some point we will be needing another large public event to sort of summarize and show progress from where we were the first time we met as a huge group there in the auditorium. Some interim event that...
We've been talking about that, and really what we're looking at is we want to get a little further down the road here and get some more information. As we've seen tonight, how far we're moving forward in so many different directions, and it's excellent, but yes, we're absolutely
What
going to
I'm
do
wondering
that.
is if you could give each of the work groups some guidance as to your timeline so that we could try to...
I don't
the
know.
economic analysis, I think, is going to be important, but it sounds like it's going to take a lot of time, but I do think we need to get out in front of the public in the not too distant future, so I'm looking for timelines.
Yeah.
Well, we're working on it as quickly as we can. You know, it's one of those things. We're not like putting this off and thinking there's no dead date, drop dead, excuse me. didn't
No,
mean to-
please.
But,
Yeah, we don't use that term.
we're doing it as quickly as we can.
So I'm
So,
just looking for whatever guidance you can give us to be ready by sometime with as much as you can.
next week.
I would say the guidance we have right now is to keep doing what you're doing, recognizing that we are going to at some point want to do another major event, but we don't want to do a major event just to do it. We've got to have a purpose to have that happen. And I'm excited tonight, hearing all the different ideas, all the things that we're doing, all the groups we have moving forward. I'm really encouraged that we're going to move this where we need to go, but we're not sure yet when that's going to happen. Bruce.
So Brian Blethyn.
Brian, sorry, brother.
I live in
Adam.
Booth Bay. So the comment of the David and Goliath just sort of struck me earlier this evening. And so my question and comment would be, at what point do you think this sort of turns from sort of an us and them kind of movement? It's great, there's a lot of positive things happening and a lot of information being shared and a lot of efforts and a lot more communication going on than maybe has gone on in the past. But it still feels like that sort of David and Goliath thing where I would think, we would all be better served if we were a little more engaged in trying to work together. Now, right, certainly it sounds funny to say that because folks feel like the hospital didn't come out and engage the community. So, but what lesson do we teach, our young folks, or do we live up to ourselves where, okay, we didn't get exactly how we wanted, what we wanted the first time around, so do we respond in kind, or do we move forward and try to, remain positively engaged with the organization that we're trying to get services and cooperation from? So that's just kind of my perception as I've been to some of these meetings. Is it's sort of this us and them type of thing, and some folks, not everybody, and I'm just hopeful that this effort can take a little bit more of a positive turn in that, okay, yes, we want to do our own thinking and gather our own data and validate and verify. I think that's a very smart thing to do. But at the same time, trying to positively engage Lincoln County Healthcare. And
From your lips to Lincoln County Healthcare's ears, I hope they continue to be open with us. We certainly have encouraged that. So far they've been, I've said from Jump Street, it's got to be a two-way street. We've got to listen to each other.
Yeah.
Hopefully they're listening to this, and hopefully they're starting to realize that maybe there is another option. We certainly will continue to throw the olive branches on the table and hope that we can work this out together. But you're right, at some point it still is a little confrontative. I mean, they've got their position still, April 1st is coming, and prepare to repel borders, and we're trying to figure out how we get there. So
Everything's in negotiation, hopefully, and if we
Right.
can convince them that they were in error some way, and if not, try to make the best out of what we can, what they can offer, and what we can produce. That's what we're looking for.
They've invited us to do that too,
Right.
through the message from Dr. Forey,
Yeah.
in which he said, show us.
Right.
you know.
Absolutely.
And
Right.
so we're rising to that invitation.
we certainly are.
Right.
We certainly are.
Yeah. And this all goes to support that effort to try to convince, hopefully we can.
Until the ambulance service has done their process of figuring out exactly how they are going to transport emergency patients that would go to St. Andrews to other hospitals, I don't think the major question has been answered. Until the ambulance service says, "Don't worry, we've got this 100%," then I think you need to worry a little bit. And that's nothing against the ambulance service. They're working very diligent and hard on putting together a plan for April 1st. But there is that large gap in not only planning but finances of what happens April 1st. And until that's answered, it's kind of hard to stomach.
Please,
I'd like to.
would you do us a favor and stand up? Thank you.
My name is Tom Hagan, and I'd like to take exception to some of what's just been said. if I were Lincoln County Healthcare, I'd approve of the idea that everybody should be nice to each other, and we should all engage in as much research as we want to do, and not do anything substantive until it's too late and we can't do anything substantive. My opinion is that we're on a road, and there are two, as they say, two paths leading from that road. I think it was Frost who wrote about that. And we need to make plans based upon the assumption that things are not going to work out with Lincoln County Healthcare. They've already exemplified the fact that they can make decisions with insufficient information, as far as I'm concerned. And we need to put together a plan for what to do with St. Andrews that does not include Lincoln County Healthcare, period. And that is one of the two paths. There's no point in pretending that two paths are one path. We need to make adequate preparation for the possibility that we're going to go off on the plan, on the path that entails an independent St. Andrews Hospital on the peninsula that is not part of the organization that has so far managed to do things without consulting people on the peninsula.
And Tom, I can assure you that as we sit here before you, that is certainly where we're going right now. That is one of the things. We are taking many paths right now, recognizing that we very well may have to do something completely different. And we are making strides in that area. Those things are being considered, but we want to keep everything on the table and not just lock ourselves into one road. We are confident that with the talents we have around us, we can handle all these options. And when it comes to that point where we have to make a decision and we go hard onto one road, whatever road that may be, that we'll have everybody behind us. But we're preparing for that aspect, believe me. Anybody else have something to offer this evening? Please.
Yes, Nancy Oliphant, sorry.
Thank you so. And just Channel 7 loves us when we get people to stand up.
Okay, Nancy Oliphant, I was just wondering what progress had been made towards the second interview with Mark Foray. There is a letter currently on the Booth Bay Register website which suggests it's from Mr. Donovan, and it suggests that that interview is sort of like the final word, in his opinion.
We certainly cannot.
And I was wondering what, if any,
We certainly cannot
progress.
force Dr. Foray, let's get that right, Dr. Foray to do another interview if he chooses not to. What we can do if he chooses not to, we can go forth with someone else to offer a different perspective. And we are certainly keeping those options open.
Because last week, he sounded like he was going to be available to anybody, anytime, pretty much, to expand upon his interview. And I have some serious questions about it.
Excellent. States, please.
So what I would say is I think that Dr. Foray is happy. First of all, he's happy to talk to anyone. So if you would like to talk to him, I can get him connected to you in very short order. He's met with several different people in the community who have called and asked to speak to him. We've told the task force if
I
they
look
want
at
another
something for
interview.
public consumption, actually.
Well, we're happy to do, my point is, we're happy to do what's suggested of us. And I
Excellent.
think that's what we said to the task force. So, and if you would like to meet with him, I know he'd be happy to do that. So you can just let me know.
Very good. Thank you very much. Anybody else have something they would like to offer this evening? Please?
I'm sorry, I don't need to keep,
We understand, Bruce. Jump right in.
but my feeling about interviews with Dr. Foray is that he's a great guy. I've tried to work with him legislatively over the years on a couple things, but he is a spokesperson for Lincoln County.
He certainly is.
And he works for them. So I do believe that if you're looking for another point of view, you need to go elsewhere to get another point of view.
I think we're headed that way, Bruce.
And I do believe that Peggy's discussion yesterday with us, while it wasn't directly a different point of view, nonetheless illustrates some of the things that
A
that
bit
could
of
be
point,
done.
counterpoint.
But it isn't a direct response.
Of course.
It wasn't intended to be that, it's just information. But if you're gonna have another interview, there are other views about rural healthcare than the
Absolutely.
ones that are presented by. So-
Well, absolutely, Bruce, and we talked about that, and I think we're talking about that different point of view coming out
And I mean,
too.
Lincoln County Healthcare should be free to do whatever they want to
Right.
do.
They certainly are.
Broadcast their point of view, but I do
That's right.
think that we
We
need to
need-
have another perspective out there.
Absolutely.
Anyone else have something they feel the need to share this evening?
I hope everybody realizes the leaders that are coming out of the community that have contributed to the St. Andrews Task Force. It seems it's always the same people sitting up here at the table. The people up here at the table, although I have a heavy hand in what they're doing, it really is the people out there that are doing the majority of the work, like Peggy and Mr. Twaddle. People that don't want to be identified, Bruce McDonald, the ambulance service. I think I just want everybody to recognize that there's a tremendous amount of talent out there. There's fundraising. It's immensely amazing to sit in my position and to watch this unfold. And then one other thing that is very important is to, like Representative McDonald said, is to stay motivated. Sometimes this is a bit of a grind, and to stay with the grind until it's completely done. Continue to show up for meetings. Power in numbers, power in having your voice at the table or at the meeting. And if you don't have anything to say, sometimes sitting in the seat is just as powerful. So continue to show up to meetings. If you can't show up to meetings, continue to watch on Channel 7. And then the people that are actively pulling strings, continue to pull strings. Thank you.
Thank you, my friend. Anybody else? Yes, please.
Just one suggestion, that, Booth Bay Civic Association meets in this room on the first Wednesday of each month. I think somebody from the task force would want to approach them for contributions.
Thank you.
That's what they're there for, so.
It's a grand idea.
I'll work on that.
Thank you. Anyone else, folks? I don't want to leave anybody out. Please, by all means, if anyone else has something to say. Okay, let's go to recap. Next meeting, my brother. What do we think?
Well, as I'm marking down
Yep.
from most recent, put on our list to contact the BCA or to contact with our assessors to get these lists of the associations' mailing addresses. Because not only are there the mailing addresses of where their tax bill is going, but they're going to have the heartbeat of correspondence to all their members. So that's on our list. I want to see if we should be working on a counterpoint interview, like Dr. Oliphant said. Did I say your name right? I'm always afraid to say it. I'm sorry.
That was perfect, thank you.
I also put on my list. I just thought it was a really. I don't want to take anything away from how briefly we touched on the mental health question, but I don't understand mental health. And I don't know how it applies to Lincoln County Healthcare. So I think I might have some questions that might originate, and we'll get those to the appropriate group.
Absolutely.
Because you have to give it to the bravery to somebody to stand up and say, I have a mental health problem and I want more information. And then we're also we have some work with the data analysis group. Is that heading in the right direction? All the questions that you have posed to Lincoln County Healthcare, or that they've been posed to Lincoln County Healthcare, and we need to just get responses to. Okay. Anything from you, Peggy, that we need to work on?
Just the list that's on the weekly update.
Okay. The next meeting, Representative McDonald, for your group.
We'll meet next Tuesday morning at 9 a.m.
What next? 2nd. Is that us?
Yes, second.
The next meeting for us will be October 2nd, same bat time, same bat channel,
So next meeting of us, October 2nd,
7 PM.
7 PM. And then the legal workforce is still, will continue to move along. That's everything I have.
And continue to send money. Thank you.
Yes, continue to send money.
With that, I'm open for that happy movement.
You got it?
Thank you, folks, very much.